Okay, this is administering NG tube feeding. First, I'm just going to verify the order and verify the type of formula, the concentration, the volume, the route, rate, and frequency of the admission. And then I'm going to gather my equipment and check the expiration date of the formula. And then I'm going to identify the patient, perform hand hygiene, assemble my equipment, and do my abdominal assessment on them, and then raise the head of the bed to at least 30 degrees, but preferably 45 degrees, and then don my gloves. And then I'm going to verify the placement of the NG tube by first looking at the marking made upon insertion right outside the nares, and then measuring the amount of exposed tube and comparing that to the documented length, and then check the pH by first flushing the tube with 30 milliliters of air, and then aspirating a small amount of secretions, visualizing the color and consistency of the secretions, and then dropping that on a pH pad. And if the pH pad indicates a pH of a 0 to 4, that indicates gastric placement. If it indicates a pH of 6 and above, that indicates lung or intestinal placement. And then I'm going to return the leftover aspirate back through the tube into the stomach, and then I'm going to aspirate all of the stomach secretions out and put them in a measuring device and just keep on going. Don't force it, but just take whatever the stomach is allowing me to get out. Then I'm going to measure all these secretions and then return them back to the patient per hospital policy. And I'm going to do that for intermittent feedings prior to each feeding, and for continuous feedings, I'm going to do that at least every 8 hours and per hospital policy. And after I'm done with that process, I'm going to flush the tube with 30 milliliters of sterile water. And with neonatal and pediatric patients, I'm going to flush the tube with the smallest amount of solution necessary to make to clear the tube effectively. And then I'm going to remove my gloves, perform hand hygiene, don new gloves, and then administer the feeding.